Adva, you need to unmute yourself.
Wow, that's amazing. It's my first time that I'm speaking so much time while I'm on mute. Thank you, my dear colleague Miriam. Before that, I said only bad things about you, but now that you couldn't hear me, I said something on mute, but now that you helped me to fix it, I'm only praising you. I'm joking. We'll do, I think that humor in this time of crisis is something that we can all benefit from. So I'll begin again. Hello, good afternoon. My name is Adva Wilczynski. I'm the Consul for Public Diplomacy in the Consulate. I want to thank Miriam that is still bringing people here from the meeting room to our conversation. We have the privilege to have here today Tali Lebanon. She's working with us in the Israeli Consulate in New York for a long time already. She's part of the Israeli Trauma Coalition. In my past working in Israel, I was working a lot with professionals working with trauma and trying to assist people and train others how could we help people to cope. And I know that one of the most important things that I learned from my experience in Israel, that in Israel, if we like it or not, we have a lot of experience with crisis and trauma. And I think maybe this global trauma and this global crisis is something that we were not anticipating yet. But I believe that with the experience that we have in Israel, we could share some of our knowledge. And I think there is no better partner to present it today, which is Tali. And I think that the Israeli Coalition for Trauma has a lot of experience, not only in Israel, but it shares its knowledge in the international perspective as well. I don't know how much of you know that, but members of the Israeli Coalition of Trauma were in Pittsburgh, arrived just a few days after the massacre in Pittsburgh in a synagogue in Etz Chaim. It was almost like in Israel, how we are taking care of our people in the community. We believe that working within the community is something that our professionals can do and should do. And from knowing so much of the Israeli and American perspective from the work of the Israeli Trauma Coalition, also here, we thought it would be a clever idea to hold this webinar and to share with you some useful methodology ideas, how you could use it for yourself to benefit, but I think even more importantly, for others, for those who are surrounding you. Many of you are community leaders, officially and non-officially. Many of us have children at home, so if it's not only for yourself or for your community, it's for your house and indoor, which we are all in usually now 24/7 in this infrastructure. I'm not a professional, so of course I will give Tali to do the professional work. But again, I want to thank all of you who are joining, and a lot for Tali, who's working with the consulate, but not only with the consulate, with so many other important communities and players here in North America, in New York. And it's our pleasure to have you here for this session. Again, thank you, Miriam, for holding everything and bringing people on board. And I hope it will be a meaningful conversation for all of us.
Thank you. So I will begin. Thank you for having me. It is a great honor. I will begin by saying a few words about the Israel Trauma Coalition. The Israel Trauma Coalition was created in 2002 at the height of the Second Intifada by the UJA Federation of New York to respond to the impact of terror that occurred all over Israel and to provide psychosocial support. Today, it is a non-profit partnership of NGOs specializing in both proactive and reactive emergency preparedness, building resilience and trauma care. Unfortunately, our experience has become an urgent international reality, positioning our preparedness and post-crisis expertise as critical. Working closely in Israel with the Homefront Command and key government ministries, municipalities, NGOs, and the private sector, the Israel Trauma Coalition strengthens individuals and communities to cope better with crisis and build sustainable resilience. Over the years, the Israel Trauma Coalition has worked in Israel and in the aftermath of global disasters, such as natural disasters, terror attacks, mass shootings, refugees crisis, and the like. Today, I would like to share with you some insights on our work principles from many years of work as they apply and provide coping strategies in helping us to respond also to the corona crisis. When crisis occurs, what we see are circles of impact. We need to create for that circles of support. Firstly, for the individuals that are impacted directly, we created a number of unique trauma-focused techniques that include clinical care and coping skills. Secondly, for caregivers, we created comprehensive programs that include training, support, and self-care. And by caregivers, we mean every provider from first responder to medical and psychosocial teams, educational teams, faith leaders, and volunteers. And we remember that everyone that provides care to trauma victim is also exposed to trauma. And so we have trainings that are targeted to the population they serve, children, families, immigrants, minorities, people with special needs. And in every program, we also include components of self-care. How does my work impact me? What can I identify that is happening to me? How can I cope? Thirdly, we work with leadership, be it directors of organizations or mayors. They cope with issues such as moving from routine to emergency, and not less difficult, moving from emergency to routine. They cope with the need to provide the right messages to the public and much more. What are the working principles of the ITC? All of ITC's work is based on and focused on strengths. We believe that our role is to help people who are coping with crisis to find their own resources and the support within and around them to be able to move forward. We know that most reactions to crisis are normal and that approximately 87% of the people will heal naturally. Still, we as professionals have a responsibility to help. We spoke about circles of impact and support. In our work, we look not only at the individual to identify needs and provide support, but also at the community. Our coping strategies focus on the positive and on being proactive. All our interventions are culturally adapted. And in our experience, in many places in Israel and around the world, we see long-term exposure to trauma, and that creates the need for special interventions and learning. The corona crisis surprised us all in its scope and its impact. Months into the crisis, we now all know a few things for sure, that it is not going away anytime soon, that there is no quick fix, and that this virus can affect anyone, anytime, anywhere. It is important to understand that everything we do now as individuals and as professionals and as a community will shape and define who we will be when this will be over. We must all maintain our sense of truth, beliefs, and values. At the ITC, we understood the impact of this when within 2 days in Israel, we moved from 400 people in isolation to 50,000. We knew that we had to act, and we understood that the old ways of response would need to change. The situation now in Israel is that 1 out of every 4 Israelis is unemployed. Many of us are still in lockdown. Some are allowed to venture 100 meters from their homes, and others are forbidden even that. Messages of panic are constantly communicated that the peak is still ahead of us, creating anxieties. Families are coping with having children at home in close quarters, including children with special needs, and many have to say goodbye from afar and mourn in new and foreign ways. With respect to the mental health aspects, the Israel Trauma Coalition is focused on reaching out to the population with guidelines for parents, rabbis, those in isolations, therapists, medical teams, those working with the elderly, youth, social workers, families who lost loved ones. Languages for some of these materials that we sent out include English, Arabic, Amharic, Spanish, Italian, French, and Russian. We are also sharing our materials and experience with other organizations in the world, including organizations in Europe. And strangely enough, they have a lot of interest in the materials that we provide in Arabic. We also work with medical teams throughout the countries. Hospital teams are overwhelmed and understaffed. 30% of the staff is in isolation. The number of patients is growing. With collaboration with the Ministry of Health, the Israel Trauma Coalition is working with all general and geriatric hospitals to create face-to-face workshops and webinars to support and maintain the well-being of doctors and nurses who are facing many emotional challenges, both on the work front and on the home front. All social services teams in these hospitals are trained to work with the medical teams to support them, minimize burnout and compassion fatigue. As for support for the elderly, this is a big issue in Israel as well as around the world. We're training social services and management in geriatric hospitals and in the old age facilities to better cope with the rising anxiety of elderly, their families, and the teams. Many elderly are in isolation in their own rooms, cut away from family support. The number of people infected is growing, and even when others in Israel will be able to resume life activities, many of the elderly will still have severe restrictions about that. Another group that we work with are minorities, which is another challenge. Whether we are talking about the ultra-Orthodox communities in Israel or the Arab society, a pattern that we see in both communities is the tendency to follow non-governmental leadership or faith leaders or non-formal leadership and their directives. And this, of course, causes a rise in the number of people that are infected. And the ITC is working with leadership, mayors, spokesmen, rabbis, and imams. We also opened a unique hotline adapted to this population, a unique hotline for the ultra-Orthodox and a unique hotline for the Arab population. And we have culturally specially adapted webinars that are carried out for their professionals and leadership. We opened a unique hotline for people who are suffering from trauma-related issues, and this hotline brings about 1,500 calls every day, which is a very big number. For the population, for the institutions of people with special needs, there are about 800 such institutions of Israel. The teams, again, there are understaffed and overwhelmed. In many of these institutions, patients were not allowed to go home, and there is a rise in number again in those infected, which means that team members are also in isolation in the facilities, and they themselves are cut off from their families and their own support system. And so for them, together with the Ministry of Social Services, we created both professional support in order for them to work with the patients, but also support and treatment for the teams. The social workers in Israel have become first responders. They reach out to vulnerable populations, to the elderly, to the single mothers. There is a rise in violence at home. All social workers were declared essential workers in order to ensure services for this population. And in collaboration with the Center of Local Government, the following trainings are offered for each social worker should he or she choose to participate. issues such as community work, working with children, working with the elderly, working remotely, and of course, the issue of self-care and body and mind techniques. A sad challenge these days is the fact that many people are dying in isolation, which creates waves of stress and grief, both for the workers in the hospitals or in the facilities, and of course, the families. Much is being said about the impact of this crisis on future mental health. There are a few very different messages about this. One message is that there will be millions of people who will suffer from emotional problems and even PTSD, and a high rise in suicide attempts or suicides. And this will be a result of the fear, anxiety, grief, disruption of life, financial worries, interrelationships that have been tested in this time of home isolation. Another version is that this period also created an opportunity for new connectedness, a stronger sense of family and community, and the fact that everybody is vulnerable makes many people feel more understood. When we speak of post-trauma, we usually speak of post-trauma after a one-time event, and we talk about a number of about 16% who will need long-term support. Here, we are experiencing, as we are speaking of long-term period of exposure to stress, we are talking of a larger number, a possible larger number of impact, and the exposure may be much bigger, and we will find a bigger number of people that are suffering from post-traumatic symptoms. So what are our next challenges? There is a lot of talk about the day after. There is no one day after. Rather, there will be many days with a changing reality, continuous difficulties, and a lot of uncertainty. If we adopt this attitude, we can be better prepared. We can be more resilient, and we can create more resilient families and communities. Powerful emotional reactions are expected and are normal. And under normal conditions, these reactions tend to fade after a short period. However, in the current situation, as the impact of the virus on our life increases, it becomes even more difficult to cope. Another and more significant dimension is a deep human fear of the disease, its consequences, and the rapidly changing reality, and of course, a profound fear of death. We need to accept that these feelings are normal, and that with understanding and coping skills, we will all be able to cope better. There is a growing sense of vulnerability. This sense of waiting for bad things to happen takes a lot of energy. Do not wait for this to end. Rather, live each day to the fullest and see what it is that you can do every day. This is our new reality. We need to build our lives around it, not as victims who are helpless and waiting, but as people who can cope, change our discourse, change our mindset, use positive words. Staying braced every day takes a toll on our bodies and minds, and so it is important to recognize our stress and take means to address it. What are our mental health coping strategies? We can make a choice, we can take control, we can take action. We should not lose the bigger picture. Collectively, we need to take responsibility for ourselves and others. We also need to adapt to this new reality. We need to find ways to maintain a new daily routine, the continuity of our lives, our values, and especially to find the new ways to stay in touch and connected, and to see this period of our lives as a spiritual, intellectual, and social challenge. ITC has been actively engaged for almost 20 years in emergencies, but more than that, engaged in building resilience. And these are the messages that I find strengthening. We are one people, all sharing the same reality and the same feelings and the same challenges. We are not victims, rather we have a lot of options and we need to be proactive. We have a choice of reframing and focusing on the strengths and on our blessings. We should be prepared for the next phase, even if it is a worse scenario, Being prepared creates resilience and a feeling of coping. And mainly that this too shall pass, and it will pass better if we work together. Thank you very much. If you have any questions, I'm ready to answer.
Thank you very much, Tali, for this amazing session. I would like to invite everyone to send their questions in the chat box, and Tali will answer as much as time allows. So if you want to do that, you can do that now. In the meantime, Tali, I will ask you a question. Could you share a little bit practice on how to deal with mental health and mental stress now, just for everyone who's on this call? If you can give us a few tips on how to treat yourself better nowadays.
I would like to say something about the word mental health. We are talking about mental well-being. We are not talking about mental health. I think when we speak about mental health, we usually tend to think about people who are suffering from or coping every day with their mental health issues. We are talking now about the whole universe, almost many populations who are dealing with crisis. They were dealing with life better before this crisis. Hopefully they will deal with life. They will get back to dealing with life better as the time goes by. I don't know. Again, I'm not very happy of saying after the crisis. I think we are in for long-term a long term of being very creative in getting used to changes that every day brings in the restrictions and instructions. We need to, of course, we need to acknowledge, to understand that everything we feel is normal, but it does have to subside. If it continues in a very high level, then we need to maybe seek professional help. But our feelings are very normal, and we need to find another adult or friends to discuss it with, and to see that what we are feeling, many people will, we will see that other people share the same feelings. We need to find, we need to also, if it is possible, to say that we are not going to think about our worries all the time. I think we can say, I'm not going to think about this now. I'm going to concentrate on activities, on relaxation activities, on spending time with my family, my children, to find, it's very important to find the best way to create a routine in our lives, not to sleep late, but to wake up and have a steady routine with the children, for the children. And even if we are alone at home, we should create a routine for time for reading, time for working, time for doing things, time even for exercising, dancing, doing stuff that will keep us occupied, mainly, yes. I think one more, excuse me, just one more very important thing that I should say is that the exposure to the media and to the news should be very limited. We should listen and look at the news and hear what they have to say about instructions, but we should not give all the day into listening about statistics and numbers. It creates a lot of anxiety, and it's not very helpful for us.
I know you've talked about, you mentioned it, but people are asking, what are practical ideas for helping children through these difficult times? You mentioned dancing, you mentioned keeping a steady routine. Are there any other tips that you can share with us?
Yes, it is very important to let the children also express their feelings. We should provide the children with age-appropriate information. We should understand that the child can only understand this much or this much, and we should try and explain to the child what is the corona crisis, what is happening, why are we staying at home. We should also convey a very strong message of safety. We're going to say maybe we cannot go out, maybe we cannot do stuff that we are used to do, but we are, not only us, the government, and we are doing our best to keep us safe. And what we are doing by staying home is keeping us safe. And even when we are trying to use positive messaging, as I said before, we should not use a word such as saying we are stuck at home, but we are safe at home. We are together in this. We should offer the children the opportunity to have roles so that they will feel that they are contributing. Whatever roles, to set the table, even small stuff, to if there is an older child, that he will teach the younger child the importance in the way to wash their hands, to create a sense of strength, that the children will feel that they're partners in this, and that they can also be meaningful in the way that the home is run. They can create games, they can lead some of the activities at home. And so the feeling of creating strength with children is very important. One very important thing to say is that the children see what the parent is doing even stronger than what the parent is saying. And so parents who are stressed need to find a way to discuss it with another adult, and try not to show this to the child as much as possible, because the child will understand that something is going wrong, something is going on, and that he has more concern that he understands.
Thank you. We have a question that I've been hearing and noticing a lot, especially on social media lately, which is asking, how should we treat elderlies and people who are in isolation by themselves and sometimes suffer from depression, from the isolation, and how should we reach them, knowing that a lot of them don't know how to use those media platforms that we're using, whether it's FaceTime, Zoom, WhatsApp, whatever it is. How can we relate to them, and how can we bridge that gap in a way and help them get over that feeling of depression and loneliness mostly?
So I think we are dealing with this in the last 2 days in Israel, and we just say this, it's not your question, I know, but I will just say that everybody who is above 60 or 65 is now put in a completely different world, whether they are working CEOs or directors or whatever, and it is creating a very big now wave in Israel of people who are upset about this. So not all the elderly are in isolation. I mean, all the elderly are in isolation, but not all of them are in the same state of mind and abilities as others. I will say that in Israel, what we did, and I'm sure you have the ability as well, we reached out to the elderly with a questionnaire. And in the questionnaire, we asked some technical questions about their need of medicine and food and technical help. We ask them whether they have anybody to talk to, whether they are alone in the house, whether they are talking to families or friends. And if they don't have enough of that connectedness, we offer them for a volunteer to call them once a day to just be in touch. We do offer those who want to be trained. There are ways to help people understand how to use social media, and many people say that they would like to do that. And we also create groups in Zoom for elderly, not really Zoom therapy, but we create peer groups, and so they are able to discuss it. We encourage them to send messages by videos or by phone to their families and grandchildren. And of course, we encourage the families to do the same over the holidays. The Passover holiday, it was very important. The Holocaust Day, Memorial Day yesterday, and of course next week in Israel is the Memorial Day for fallen soldiers, and many of the families are in Israel, at least are elderly, the bereaved families, and so there is a great need to reach out to them, to offer support by phone. We also send out materials to the elderly, written materials in languages to say, to give them some normalcy of the feelings that they are feeling, and to provide also some coping skills. But of course, when I began by one extreme, and that is those who are very independent, I will relate to the other extreme, elderly or others who are at home and are feeling depressed. We should reach out to them. We should make sure, and they should make sure, that they receive professional care.
Thank you so much. I just wanted to say that there's a lot of amazing organizations, even led by young adults nowadays, that reach out. Of course, following a lot of news reporters who've been doing a lot of articles about elderlies who are feeling lonely, about Holocaust survivors, and just people who are being alone during Passover and those holidays. So there are ways, and I'm so happy to hear that you're offering them. And we're going to add that we can send those materials to this group of people online afterwards, so you can use them and use it as a source to kind of start on this initiative of talking to people, calling them, even if they can't use FaceTime or Zoom, seeing, like, approaching them where they're at. Another question that we have here is an interesting question about terminology. How do we explain to ourselves and to the people in our lives using a terminology that it can be a lot worse? Comparing here, there's an example of people who survived the Holocaust. How do we explain to ourselves that in different ways that it can be worse, and we are blessed that we only need to, in a way, stay home and watch TV?
It can be worse, but it can also be better. And we have a choice of choosing where we want to put our focus. If it will be worse, we will cope, but we can make it better. And we are trying to make it better every day when we wake up and we choose what activities to do, and how it is that we can contribute to others, and how it is that we can connect with the people that we love. And of course, for professionals and for adults, I believe that understanding that it can be worse and preparing for it to be worse is a good thing, but we cannot let it get control of our lives, because it's not going to be of any use. And so we need to understand, what do we mean by worse? We should put it even on paper. Does worse mean that I will not be able to go shopping? Nobody, for food, I mean. So what options do I have? Does worse mean that my children cannot come and visit me? What options do I have? Does worse mean that my team will be sent home and they, as many people in Israel will be unemployed for months? What can I do for my workers? And so getting ready for this part that is worse in a practical way will help us. But then once we do that, we should move into thinking how we can make every day better. And if it gets worse, we will be ready and we will cope with it.
Amazing, thank you. There's another question about, is there a model of a questionnaire that people can access, that people can use for the elderly?
We will send you our questionnaire, and you can change it according to, we'll make it appropriate to North America or to the group that you are using. We will send it to you in English, and you will send it out. You can use it any way you like.
Thank you so much. I think we ran out of time, so I'm going to pass the torch to Advan. I just want to say on a personal note, thank you so much for taking the time and sharing your knowledge, your practice, and the amazing work that ITC does every day, and especially today. Thank you. And Advan, it's yours, just unmute.
First of all, Tali, really thank you. I think it was, sometimes I write and I say it's inspiring, but I think in this time to get such a positive message, and we're already with this, in Israel a bit longer, here in the US, I think most of us are feeling in this strange routine of life that become our regular normal about like 5-6 weeks. And it's beautiful to get a ray of light, a ray of positivity. And if you check my Twitter account, I think the first thing that I write there for myself that I'm a positive person. But this important emphasis on choice. We all had a choice in life, and some choices we don't have. Like none of us were chosen to come to this life to be a girl or a boy, or where should they, to which person to born to, but we do the best with what we have. and this is what we have. Like, I don't know, I'm not a doctor, and I'm not a biology expert, so I cannot change or find a cure. I can only do in my little space, little land. And what you said really, even though that I'm an optimistic person, gave me again enforcement to what we think. You know, what's amazing in this crisis and with your message, that it unites us all. And I think that's also part of your daily to day life. And when you come here for missions, in either if it's here or in Nepal or in the EU, we are people, we have hearts, we have mind, and we talk from the heart to the heart. So really, thank you for the time. I don't know if you hear some mumbling near me, because we all have a new reality. So while we speak, we have this little cutie. So we are all coping with the situation and trying to do good work while continuing our life.
Yes.
Maybe she could say, you want to say a word of, she's bringing people happy, you know, to say happy. Happy. So really, with the message of happy, say happy. Happy. I'll try it.
And thank you very much.
And thank you.
You're welcome.
Thank you, everyone. This session was live on Facebook, so if you'd like to share with your communities, it is on our page. You can just press the share button, send it to people privately or on Facebook. Thank you, and Shabbat Shalom.
Thank you
Thank
very much.
you. Bye-bye.
Thank you. Bye.
Very much informative and helpful. Thank you.